So a few months ago, our clinic decided to hop on this trend where people of different medical specialties say some things they wouldn't do, and this is what I said.
One thing I don't do as a naturopathic doctor GI specialist is regularly take NSAIDs, non-steroidal anti-inflammatory drugs like Tylenol or ibuprofen. They can harm your liver, they can harm your kidneys, they can harm your gastrointestinal tract so much that it bleeds, and that risk is tripled if you're drinking any alcohol.
So yeah, I thought that was relatively straightforward and uncontroversial. Hesitate before taking NSAIDs all the time. But some people reached out and had the question, if you don't recommend taking NSAIDs regularly, what do you do instead when people would normally take NSAIDs? So that's why I made this presentation on non-steroidal anti-inflammatory drugs, or NSAIDs. And I want to talk about what those are. So there's a bunch of them over the counter and some prescription ones, but in the US, the most common ones are aspirin, Advil, and Aleve. And there's one other drug that gets bunched in here that's not an NSAID. That's acetaminophen or Tylenol. And it's not considered an NSAID because it doesn't have significant anti-inflammatory benefit, but it does relieve pain and it does reduce fever and it may work through similar mechanisms. So we kind of lump them all in together sometimes. And I'm going to be talking about this group of four, really. So yes, they can harm your liver if you take them too much, especially your kidneys. And even at normal doses, like you're supposed to take, they definitely, if you take them for a while, can harm your gastrointestinal tract so much that it bleeds. So what do we do instead? What are our alternatives? And really, it depends on what you're taking them for. There's four main reasons that people take NSAIDs: fevers, headaches, dysmenorrhea, which is the pain and discomfort that comes with menstruation, and then musculoskeletal pain. That could be achy muscles or joint pain, that type of thing. And there are other reasons why people use NSAIDs, but these are the big four. And originally I thought I would talk about all of these in one video, but it turns out there's just too much information. So today we're just going to talk about fevers. And I tell my patients all the time, getting a fever is like sending your immune system to the gym. It might not feel comfortable while you're doing it. There may be pain. You might want to avoid it. But it's going to make you stronger. It's going to make your immune system stronger in the future. And I'm not saying never use NSAIDs. If you have a sick toddler in bed and the discomfort of the febrile response is just too much, or it's keeping them from sleeping, which is healing also, sure, you could use an NSAID. I'm just saying don't lower them just to lower the fever. Lower them only with a specific purpose to improve quality of life in that moment, and use them judiciously. I tell people your birthday comes once a year. It doesn't happen often. It's a special event. And so maybe you take off work or you don't go to school or you stay home and take it easy. And most adults don't even get a fever once a year. It's maybe every couple of years or something. So when you get it, don't miss that opportunity to make your immune system stronger. Don't just take an NSAID or Tylenol and suppress the fever and go to work or go to school. Take the opportunity and slow down a little bit and stay home and take it easy and let your fever do its work. So this is my daughter when she was 15 on October 31st, and all her friends were going out in scary costumes. And I texted my friends and family, this is the scariest thing you'll see all day, 105.1 fever. And I do want to make a side note, if you're not a medical provider yourself, then if your kid gets a fever, for sure if they get 105 fever, call their doctor, bring them on board. Fevers are not going to hurt you by themselves, but they're often a sign of something serious that could be really harmful. So don't just go it alone. Bring on someone who knows what they're doing. And so I just made this statement that fevers are not going to harm you. And here's why. The febrile response, which includes this high temperature and a bunch of other stuff, is this carefully orchestrated experience where your body is regulating what the temperature is very carefully and protecting your cells from potential harm by these high temperatures through these amazing things called heat shock proteins. And I'm going to die on this hill here. Conventional medicine providers, fight me on this. I couldn't find any information in human studies or animal studies that a fever as part of a normal febrile response could hurt anyone below 109. And this was just in a rat study. And I actually couldn't find anything that a fever as part of a normal febrile response in humans hurts you at any temperature. At lower temperatures, there are some transient harms, like you'll have some muscle and liver proteins denature and degrade. Really, that's intentional. The body is degrading those proteins into amino acids to use those amino acids to build immunoglobulins, aka antibodies, to mount the febrile response that it wants to mount the immune response that it wants to. And at 109 in rats, there was a lasting brain edema. At lower temperatures in rats, there were transient brain edemas. But I'm going to say I don't have any evidence that a normal febrile response will hurt you at any temperature. In fact, our white blood cells work most efficiently, maximally well at those febrile types of temperature. And bacteria and viruses and actually fungi too work less well at those high temperatures. They work ideally at humans' normal body temperatures. There's good evidence that viral respiratory infections, bacterial respiratory infections, and gastroenteritis are all less severe, shorter duration, and less contagious the higher your fever is, as long as you're not suppressing that fever with NSAIDs or Tylenol. So antipyretics are the word for these fever-suppressing drugs, and you might worry in our sickest patients, critically ill patients in ICUs, do they benefit those patients? No, they do not benefit critically ill patients in ICUs, and in fact they increase mortality in patients with sepsis and in patients with seasonal influenza. And there's this phenomenon where kids can get a real high temp and then actually have a seizure response. And parents think, oh, maybe that's when I should use antipyretics and lower the kid's fever. But no, antipyretics do not reduce your risk of getting febrile seizures. So there are a few caveats that I want to mention. And the first one is that hyperthermia, like from heat stroke, like if you're out in the hot sun, exercising, not drinking enough water, not cooling down, you can get an elevated temperature that is not accompanied by this carefully orchestrated response with heat shock proteins and everything else. And so that's not the same as a fever. And elevated temperatures from that type of heat stroke associated hyperthermia can absolutely harm you. Any temp over 104 with traumatic brain injury, hyperthyroidism, or heat stroke causes damage. So caution. Elevated temperatures can harm you, just not when they're part of the normal febrile response. If there's not traumatic brain injury, hyperthyroidism, or heat stroke on board. So antipyretics do decrease that febrile discomfort. That's what they're good for. And sometimes that is the right choice. You've got to decide for yourself and your kids, is decreasing their discomfort worth some small amount of risk or maybe slow recovery depending on the diagnosis. And especially if a fever is making it hard for you or your kid to sleep, because that's medicine too. Also, I want to repeat this. I'm not saying a high fever shouldn't worry you. It's just that the fever itself is not the problem. The fever is part of the answer usually. The problem is whatever your body is fighting with the fever. So if fever is a good sign to pay attention, take action, bring on your medical team, but don't think that the fever is the problem. The fever is part of the answer. Call your doctor when there's a fever. The other caveat, and this is the last one, there's a few groups of people, if you're immunocompromised, or if you're a tiny baby, or if you're very old, then really any kind of fever is extra alert to get in touch with your medical providers. I found one, and exactly one study, bring it on if you can find more, where any kind of NSAID actually benefited in somebody who was ill. And this is this 2024 study from just this past December. Acetaminophen administration reduces acute kidney injury risk in critically ill patients with C. diff infection. So again, I'm not saying there's no place for NSAIDs, but just a very limited role compared to how they're currently used now. Okay, here are some bonuses of fevers. In this theme of sending your immune system to the gym, kids with more fevers in their first year of life are less likely to develop allergies later in life. Their immune system gets the practice it needs to recognize what is a pathogen that needs fighting and what isn't a pathogen. Also, the more fevers you've had in your life, the less likely you are to develop cancer. There are hints in the literature of antipyretics, the use of antipyretics being associated with developing certain autoimmune diseases. This would fit with my theory, but this is not proven, so this may or may not be the case. But a reduction in allergies and a reduction in cancer, these are bonuses of letting your immune system spend time in the gym by having a fever. So, what do we do instead? This is the question. If you have a fever or your kid has a fever, one thing we do, and that I did with my 15-year-old daughter when she had 105 fever, is we used neutral bath. This is where you put someone with a high fever, or sometimes not, into body temperature water for, it can be a half hour or an hour or more. This has been used for over 100 years. And in modern times, neutral bath with baking soda, just 2 or 3 teaspoons of baking soda in it, has been shown to reduce stress, improve sleep, and improve immune function. And I know when I put my daughter with 105 fever into a bath that felt completely neutral to my touch, it felt very cold to her, and it brought down that fever a little bit. Another thing we gave her, and that has been used in botanical medicine or herbal medicine for a long time, is the herb yarrow, Achillea millefolium. I love this plant. This is historically used for fevers, not to reduce the fever, but to enhance the fever, to enhance the febrile response and allow the fever to do the work it was sent to do so it can then break on its own. The fever has done its work. We can allow the body temperature to come back down. Part of the mechanism of action of yarrow is that it's a mild vasorelaxant, but it also has antibacterial and antiviral activity, and that might be why it is helping in part as well. So those are my 2 main alternatives. 3 alternatives if you count truck through it and just suffer and let yourself suffer as an alternative. So truck through it, use a neutral bath, use yarrow, and when you do choose to use antipyretics, just a couple of small pieces of general advice. One is aspirin is probably the least effective at lowering fevers. And when given to kids during a viral infection, there is a tiny chance of a horrible and sometimes even fatal condition called Ray's syndrome. So most parents know not to use aspirin in kids, and used a lot less these days than it was in the 80s and 70s and before. So many parents know about this, but I want to make sure people know. And ibuprofen is probably the most effective and safe over-the-counter antipyretic. So we talked about fevers today. I hope to talk about headaches, dysmenorrhea, and musculoskeletal pain in the future, but I hope this was a good kind of introduction to what we do instead of use NSAIDs.